Don't be scared.
Okay.
Good day. Welcome to NACTV's Coffee Chat. My name is Lyle Watson, and we're pleased to have a program today entitled Pharmaceutical Assistance in Quitting Smoking. So our topic today is to quit smoking, and our guest is Kristin Hackowicz.
Tibbett. Tibbett.
Oh, Tibbett, sorry. Thank you for
okay.
joining us today, Kristin, and talking about your program here today. And we look forward to finding more out about the program. And what is the name of the program, the official name, and when did it get started?
Okay, so the official name of the program is Quit Smoking with Your Manitoba Pharmacist. And this program was launched by the Manitoba government in April of 2022. So about 2 years ago.
So it's a Manitoba provincial government program.
You betcha, yep. So it is the first health-related social impact bond to support people to become non-smokers. So I had to look up the social impact bond definition just to refresh myself. So it is a social impact bond is a contract with the public sector or governing authority where it pays for better social outcomes in certain areas and passes on part of the savings achieved to investors. So the goal of this program is to help Manitobans that smoke become non-smokers.
Yes.
Yeah.
So that's a very worthy goal.
Yes.
And they've put forward a good program if people respond to the program and come and get the assistance.
Yep.
And in order to get that assistance, they come and see you, or just come into the pharmacy, and any of the pharmacists can help them with the program.
Absolutely. All the pharmacists at Harris Pharmacy are trained in the smoking cessation program. So in addition to our regular schooling, we also had to take a 5-hour program called Quit. And it just kind of was a refresher on all the different products for smoking cessation, ways you can help your patients, that sort of thing. So we are all certified to be able to participate in this program.
So what is the response been to the program at this point in time?
So at our pharmacy, we have currently 5 people enrolled in the program. And that's right now. Over the last year or so, we've had upwards of 20 people enrolled in the program. A lot of our patients that are in the program are very responsive. They're very grateful for the help. They seem to just need that little bit extra help, and it seems to give them more success longer term. When someone's checking in on them and seeing how they're doing, if they're having any struggles or if there's anything we can help them with.
So is there a regular schedule set up when they register that they come and talk to you, and you continue with helping them not only with the pharmaceutical end of it, but also the counseling end of it?
So when a patient first expresses their interest in the program, we make an appointment with them, and then we sit down with them and we go through an initial assessment. This takes about 20 to 30 minutes depending on the patient. So initially we meet with them, we assess whether or not they are ready to quit smoking, if they're at that point in their life where they think, yes, I can do this. We go through their medical history with them, past medical conditions. We assess their smoking status. So this is things like how soon do you have your first cigarette when you wake up in the morning? Which cigarette would you hate to give up most in the day? One of the other assessment questions is, do you smoke if you're still sick at home? Do you still get up to have a cigarette? And then based on that, we can kind of assess their dependency on cigarettes. And it's just kind of on a scale of 1 to 10, how dependent they are. So this just kind of gives us an idea of how much counseling they need, how much support they're going to need if we feel they're ready to quit now. So yeah, we go through that with them, and then we kind of discuss their discuss kind of their struggles or what they are worried about or what they are concerned about, and try and help them with that, kind of work through those situations. And then we decide on the appropriate therapy for them, so what kind of medication they need, if they need any at all. And then after that, we get them their medication, and then we do follow-up appointments. So initially our first appointment we like to have in person to create that bond with the patient so that they know us, we know them. But the follow-up appointments can be by phone, which we find for most patients is a lot easier for them in their workday or whatever they are doing. A quick 5 to 10 minute phone call. And this phone call, we call them follow-up phone calls. And we just kind of discuss how they're doing, if they've cut back, if they've stopped smoking, if they're having any concerns, or if there's anything that they're really struggling with, then we can talk to them and help them with that. And they can have up to 9 follow-up appointments in this program throughout the year.
Okay.
So initially, I usually like to schedule a patient's first follow-up in about a week's time, see how they're doing, and then from there we just base it on how they're doing in the program.
Okay. And there's no charge to the customer in this
Nope.
case?
So there's no charge to the program. Anybody can enroll. There's 3 criteria that you have to meet to be able to enroll in the program. So you have to be 18 years of age or older, you have to smoke cigarettes, and you have to have a valid Manitoba health card. So when the patient enrolls in the program, if they agree to the initial assessments and the follow-up assessments, then they receive $100 worth of smoking cessation product. So that can be gum, that can be lozenges, the nicotine patches, or it can be the medication called Champix.
Okay.
So there's 4 different options for the patient. They can combine, like if they would like to have patches and gum, they can combine their products, but they do receive up to $100 worth of free products provided they go through the questionnaires and sign up for the program.
So the program itself is just for nicotine-based
Yep.
smokers?
Yeah, so
Type
you
thing.
have to smoke cigarettes to be able to enroll in the program.
Yeah.
Yeah.
Okay.
So I just had a client last week ask me, they vape, and they asked if this program would help them with vaping, but unfortunately you do have to smoke cigarettes to be able to enroll in the program.
Yeah.
Yeah.
What for if some reason, like if a person wanted to enroll anyway,
Yep.
say if he was vaping or
Yep.
she was vaping,
Yep.
and if they wanted to pay for the program, would you assist them in that case?
Yeah, absolutely. Like we are always open ears to listen to whatever patients need. We can provide counseling for them. They can always come in. We can have a quick discussion on how they're feeling, how they're doing. We just wouldn't be able to give them the $100 free product.
Yeah.
Yeah.
But
Yeah.
you're still there for the
Absolutely.
counseling aspect of it. I'm just thinking of the average age. You had mentioned that you've had quite a number of
Yep.
subscribers over the couple of years you've been in. Is it 2 years? Yeah, it's 2 years.
2 years. Like it came out in April of 2022, but I feel like we didn't enroll our first patients till about June of 2022.
Okay.
So,
What is the average age? Do you have any idea on that? Is it are you dealing more with older people, younger
No,
people, or?
I would say we're dealing more with people late 30s, 40s, 50s seems to kind of be our average age. Yeah, not so many younger people, I would say.
Yeah.
Yeah.
Yeah. What if you had a message today to younger people about not starting smoking? Period. Would you have any words that you'd like to share with our the younger people that aren't smoking yet and
Yeah.
are thinking about it?
I would tell them not to. It's a very expensive habit now, and it can really have significant effects on your long-term health. Whether you smoked when you were 20 and now you're 60, you still have that history of smoking. So if a patient never smokes in their life, they're less at risk for things like lung diseases, heart disease, certain types of cancers. It's just something that puts you at more risk if you do smoke.
Yeah.
Yeah.
And as your profession as a pharmacist, people that smoke that have long-term health issues.
Yep.
The ones that smoke, are they as acceptable to the benefits, their system acceptable to the benefits of pharmaceutical products?
Yeah, like these products can help anybody of any age. We've had patients that smoked significantly and have quit smoking with us, and It significantly reduces your risk of certain cancers. It significantly makes your breathing better. You have less reliability on certain types of puffers and stuff like that when you are a non-smoker.
Yep.
People just generally feel better when they quit smoking.
Do you have any idea what length of time it takes from the time a person quits smoking till they start to measure the benefits of being a non-smoker?
I don't know specifically that answer, but I do know, like, when a patient comes into us, we like them to set what we call a quit date. So they come in, we go through all the scenarios, we go through all the questionnaires, and then we want them to be very ready to quit. So we tell them, give us a date where you want to be stopped smoking by. So that date doesn't have to be tomorrow, it doesn't have to be a week later, but it does need to be within 1 month. So when we discuss with patients, we always tell them to cut back slowly. Don't go 0 to cold turkey, because that can provide you with withdrawal symptoms and make you not feel well. So we always try and tell people to gradually cut back to prevent those big withdrawal symptoms. And it makes them feel better. And then we do find when people are at that end stage mark where they don't smoke anymore, we hear them tell us, like, I feel so much better, my lungs are better, I can walk better, I don't rely on my puffers all the time. So it's just, for your overall health, it is better to quit smoking or not ever start smoking.
And thinking of starting smoking, it's probably easy to do even if you've been quit for quite a length of time.
Yeah.
Do people ever get rid of that craving at certain points of something will trigger that craving?
Yeah.
Did a smoker ever get rid of that?
I don't think so. Like, I think it's always with you. Your withdrawal symptoms go away, obviously, after a certain period of time, but I think a lot of people can be stopped smoking for a long period of time and still have those triggers or those cravings if they're around somebody smoking or just something that used to trigger them in the past. So I feel like you just have to be very strong and remember why you quit smoking and remember how good you feel when you don't smoke. Yeah, and it is really good to make sure you have support around you. You want to be very open with your decision to quit smoking. Let your family, your friends, your spouse know so that they can support you as well, which is a really big thing. Like, if you can have people that support you and help you and know what you're trying to do, then that kind of makes a big difference as well.
Yep.
Yeah.
I was just thinking, Kristin, in terms of financial management, that decision to quit smoking or not, if a person was to keep a regular account of your expenses or money spent on smoking, it might be quite a astounding awareness for some people.
Absolutely. When you quit smoking, it is a significant savings. We always encourage people to kind of keep track of how much they would have smoked when they're stopping smoking, because that can be a really big factor in it as well, or a really big part of the encouragement. We always tell people, like, put that money aside and go on vacation or do something with it because you deserve it. Like, if you can have yourself quit smoking, it's a big money savings. So everybody can use that right now, right? With everything so expensive.
And come the end of a year, if you quit smoking for a full year, there's there's going to be quite a few dollars available.
When I was in pharmacy school, they were telling us it can be like $7,000 a year in savings, which is so significant, right?
Yeah.
Yeah.
Wow.
I know, it's huge.
It is huge.
Yeah.
In terms of the duration of this program, this particular program, how long is it going to be with the pharmacists?
Yep. So when the Manitoba government created the program in April of 2022, they put a cap at the end of it. So we have until March of 2025 to enroll patients in this program, or until they reach 4,500 patients enrolled in the program. So I don't know right now where we're at with that based on Pharmacist Manitoba, how many patients we currently have enrolled, but we do still have about another 9-10 months to do the program. The government bases their succession rate of this program at 30%. So they would like 30% of all patients enrolled in the program to be quit, to stop smoking.
Yeah.
Yeah.
Well, that's certainly a worthy goal.
Yeah.
And our hopes that they will accomplish that. And,
Yeah.
or the people will accomplish
Absolutely.
it themselves
Yep.
and quit smoking. That would be something. So I guess it's not a today or tomorrow type of thing, but if anybody or our viewers are interested in the program, I wouldn't wait too long then before they
No.
come down and have a discussion with you.
Yep.
And then make a decision
Absolutely.
from there.
Like even if a patient or a viewer is thinking about it, maybe they're not quite there yet, but they're just intrigued by what we're talking about today, we always welcome people to come into the pharmacy, talk to the pharmacists. All three of us are trained in the program, so it doesn't really matter who's working that day. We're always open to discuss with people their smoking history if they think they're ready, but we do have until March of 2025, so that is a significant amount of time if a person is ready.
So if they didn't register till, say, March of 2025, would the ones that register late, would they get the benefits of the program beyond the 25th of March, or the March
No,
25?
as of right now, they're ending it in March of 2025. So,
Okay, yeah.
and that could change too. I don't know if that's a hard end date, but that's what they're telling us right now.
Yeah.
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 So,
What are some of the other points of the program that may be of interest to our viewers?
So, what have I? Yeah, so the first step is deciding when it's time to quit. So when you're
Okay.
ready, you come in, we can go through it all with you. We do like to remind people there's lots of benefits to quitting smoking. So there's health benefits, obviously. This can reduce your risk of heart disease, diabetes, lung disease. It reduces your risk of many different types of cancers, saves a ton of money, and it helps people feel in control. So when a patient can stop smoking, they've really gained that control of their life. They have beat their addiction. So a lot of people feel really good after they do it. And it's something that some people tell their friends about it while they're doing their smoking cessation, or they don't, and they're just all of a sudden stop smoking. They're not smoking. They're not going out for a smoke break. And a lot of people are really encouraging. We find that when we have patients in the program, it's important for them to have that support around them, have the support of their spouse or their roommates, their family. It's a really great thing. Like if we can get one or two people to stop smoking, that's better than none.
Yeah.
Yeah, for sure. So we talk about having someone when they know that they're ready to quit smoking. So this is someone that has made smoking cessation a high priority on their list of things to do. They are confident that they have the resources to do this, and they're confident that they have the support around them. And like I said earlier, we want them to have that quit date within 1 month of our initial assessment. So,
Yep.
Yep.
Just thinking about our mental well-being, and you mentioned it gives the person a control
Yep.
over their life.
Yep.
That has to be a positive effect on our mental well-being to
Yeah.
have that
Yep.
control of ourselves
Yeah, absolutely. Like it's something that you do for yourself.
for ourselves.
Right? Like a lot of people will tell us, I'm quitting smoking for my spouse, my family, my kids. But we also like to remind them, like, you're also doing this for yourself because
Yeah.
it is a betterment of you.
Yeah.
You're improving your health, you're improving your well-being, your mental state. It's, yeah.
Yeah.
And I know a lot of people smoke due to stress, right? You hear a lot of people when we talk to them, their triggers will be stressful situations, stress at work, stress at home, and that's a big trigger for a lot of people. So when we're going through that initial assessment, we discuss their triggers. We want to know what makes them want to have a cigarette. So then we try and combat those situations. We try and give patients just better things they can do in those situations where they're stressed and feel like they need a cigarette. So we try and brainstorm with them what are other things you can do instead of reaching for a cigarette.
So there are good alternatives.
Yeah, absolutely.
Yeah.
Yep. So we try and encourage them to, you know, if instead of going for a break at work where you would have a cigarette, go for a walk instead, or find a friend that maybe doesn't smoke or is helping you out. Take a walk, have a conversation, and don't be afraid to tell them, you know, I'm struggling today, or I'm feeling like I really want to have a cigarette, because if somebody is on your side and supporting you, they're always going to help you to kind of avoid those situations.
Well, it kind of makes me shudder when I see younger people walking down the street or standing around smoking, and I'm thinking of the personal individual, depending on age. If you want to be able to set a good example for your children, for your grandchildren, your great-grandchildren, and for your friends and neighbors, what a way to do it, to be able to quit smoking and be able to stand there and say, I've quit smoking.
And it's always going to follow you, and you're always going to have those triggers. It's never probably something that really goes away. But you just have to be strong enough to remember that you did it one time, right?
Yeah.
And there's lots of people that will stop smoking, stop smoking for a year or two, and then come back and say, oh, I fell off and I am back smoking, but I want to try again. So there's always that ability to come back to us, and we can always help you with it.
But the second time trying to quit smoking is probably worse than the first time.
Probably.
It's harder.
Yeah.
I think. Harder,
Other than you can do it, right?
Yeah.
So, the first step is just to come into the pharmacy and have that conversation with us. So, we encourage everybody and anybody. If you're our patient, if you're not our patient, it doesn't matter. You don't have to see a physician before coming to see us for this. It is something that we can prescribe for ourselves. So the pharmacist can prescribe you medication to quit smoking. So it's something, if like on a Tuesday morning, you're like, today's my day, come in, see us, we can get this going right away. So
it's obvious, Kristin, it's not a real time-consuming effort to work with you or the other pharmacists at Harris Pharmacy about quitting smoking. It's not that you have to be there every day or an hour here, an hour there.
And we try really hard to work around patient schedules. Everybody's busy. So if they need to have a follow-up appointment on the phone on their lunch break for 5 to 10 minutes, that's something that we can definitely accommodate. So we want to make it as easy as possible for our patients to take this road.
So I was just kind of interested, you mentioned you can prescribe the medication for the to help to help them quit smoking. But there's at this point in time, there's other medications that the pharmacist can also prescribe without doctors. And it's just in addition to the non-smoking. What are some of those?
So our practice of pharmacy is expanding. We're hoping it will expand a lot more in the future. But just in the last couple years, pharmacists now are able to prescribe for a urinary tract infection or UTI. There's certain criteria that you have to meet. You have to be female. You have to be non-pregnant. You have to be over the age of 16. And you have to have had one before in your lifetime. And then there's just other questions that we go through. If it's something that we feel needs to be referred to a physician, then we would ask the patient to make an appointment with their doctor. But if it's a pretty straightforward case, they've had it before, they know kind of what's going on, then we can do an assessment on them and we can prescribe them an antibiotic. So it's not that we are able to do all the things that a doctor can do, but we can do this first initial prescribing. And then we always encourage our patient, if it doesn't clear up, then please go do and see your physician. We do have to follow up with the patient on that. So in 3 to 5 days, we would just give them a quick phone call, see how things are going. And so we're getting where we want to be.
That's good for the community.
Yeah, absolutely.
And I was just thinking of community, and some memories have floated through my mind about your grandpa Jack Huxley and your grandma Marie, and when your grandpa owned the Neepawa Banner or the Neepawa Press along with John Oslin. And are you old enough to remember those days?
I'm not old enough to remember those days, but I do have lots of pictures of those days. And this building my grandpa used to own, which I think is super cool.
Well, I had the memory when walking through when I entered the building today, and many times I come in and had wound up doing some advertising through real estate and our auction business. and your grandpa was always there to serve us.
Yeah.
You know, yeah.
He was a really great person.
Yeah.
Yep.
Yeah. Well, is there anything else or any other points that we want to get out to our viewers about the program itself, Kristin? Or?
Well, right now in our program at Harris Pharmacy, we have one patient that has reached her 2-year point of smoking cessation, meaning she has been stopped smoking for 2 years, which she was one of the very first patients we enrolled. She's our biggest success story. It's awesome. Like, it's so great when we see her. We're just happy for her, and it's one of our first great successes. We have 2 patients right now that are at about the 1-year mark of smoking cessation, and we currently have about 3 or 4 patients that are at about their 6-month mark. So it's encouraging for us to have these patients that we have been able to help, and it's encouraging for them, and we really encourage just anybody that feels like they're ready or sort of ready or just want more information on the program to come in and see us anytime. So yeah.
So to this point, in your opinion, the program is being successful?
Yeah, I think so. Like, I feel like there's always room for improvement. We can always try and get more patients enrolled in the program. We try to get the word out there. We have a Facebook page that we try and advertise on our services, including this quit smoking one as well. We have a sign right where you drop your prescriptions off in the pharmacies that we can prescribe Champix, just ask. There is a website. It's www.quitsmokingmb.ca. And on this website, it lists all the participating pharmacies in Manitoba. So there are a number of pharmacies that are enrolled in this program. If you're unsure, you could just go into your pharmacy and ask them if they are enrolled in the program and if it's something they can help you with. I know there's a number of different pharmacies. So I feel like it's a really good program put out by the Manitoba government and Pharmacist Manitoba. Just a really good partnership to encourage patients to quit smoking for the betterment of their health, their financial state, everything. Yeah.
So for our viewers that may be outside the Nipawin district and wanted to get more information, if they went down to their local pharmacy, they'd be able to get the information.
Absolutely. Phone your pharmacy, ask them if they're enrolled in the program. You could check that website out that I listed earlier. Or you could phone us at Harris Pharmacy and we can help you out too. Yep, for sure.
Well, as usual, our time has slipped away rather quickly, Kristin. And before we leave, do you have any maybe final thought that you would like to share with our viewers about the benefits, the program itself?
Okay. I'm just going to read you a quote from our pharmacy president, or Pharmacist Manitoba president, Darren Murphy. Evidence shows that individuals attempting to quit tobacco products have the best chance of success when counseling from a healthcare professional is combined with effective medication treatment to manage cravings and withdrawal symptoms. Pharmacists have the skills and expertise in tobacco cessation to help Manitobans develop a personalized plan and follow through. As we are some of the most accessible healthcare professionals, pharmacists serve communities across Manitoba, and we are very excited at the opportunity to help address one of the most important public health issues our province faces. So, the health risks of smoking are preventable when you don't smoke or when you stop smoking. So,
well, that's a nice way to sum up our program on a very positive note and the benefit of the program itself, Kristin. And on behalf of NACTV and our viewers, I'd like to say thank you for taking the time to join us today. Well, and thank you for working with such a beneficial program to society.
You betcha. Well, thank you for having us. We were very happy to come across the street. We're not going to be your neighbors for much longer, but it was an easy, quick trip to get here.
Well, thank you for coming, and you have a good day.
You too.
Well, thank you for watching, and I hope that you have enjoyed our program today with Kristin about the benefits of non-smoking. And in all sincerity, I hope that we reach some viewers that may accept the invitation to come down to Harris Pharmacy and talk about quitting smoking, because it's well worth it, and I think we all know that. So, again, my name is Lyle Watson. Thank you for watching. Until next time, stay healthy and stay happy.